7:47 your time right now, and many people are on edge these days of coronavirus pandemic, especially as states start to ease their restrictions. But there's a tipping point at which those nerves turn to panic, and this heightened level of anxiety is what's referred to as reentry panic syndrome. Joining us now live to address the fear is psychologist Dr. Roseann Capanna-Hodge. Doctor, great to have you here with us this morning. So I first want to ask you, what is the difference between anxiety and reentry panic syndrome?
Yeah, well, good morning, and thank you for having us on today about this. So what reentry panic syndrome is, in the difference between anxiety is something that is a stressor, whether it's known or unknown. It can be something that's perceived or real, and anybody can have anxiety, and there's clinical anxiety, and then there's levels of just worries and anxiety. What the tipping point for reentry syndrome is, you are worried about re-entering the world, and you've been in quarantine, and there is a valid concern about getting sick, and people are panicked. They are experiencing extreme levels of anxiety, and they are unable to return to work or their job.
Okay, so what can we do to mitigate those feelings?
Yeah, so, just like you would with regular anxiety, you're going to want to have self-care. And that's a big word and a popular word that people like to talk about, but it's really finding ways to manage your stress. And that's the first thing. So you do want to check in with family and friends. You want to start practicing leaving the house. So, I have a protocol called the REPS protocol, and that protocol really is a 4-step process to help you get back, and that's respirate, envision, positivity, and stress management. And it's really respirate is breathing and practicing breathing so that you can get your nervous system regulated. You want to envision yourself being successful, using positivity, using words like talking out loud to yourself. I'm going to the park. I'm going out in my neighborhood for 5 minutes, 10 minutes, short amounts where you're comfortable. Practice it, but see yourself being successful. It's very, very this research shows us that when we use positive words, we're much more likely to be successful. We're accessing that subconscious brain. And then stress management is the last part of the REPS protocol. And you want to practice daily things that calm your nervous system down. So that could be breath work, that could be meditation, that could be biofeedback, yoga, whatever speaks to you of any age. I mean, this is a very real problem that isn't going to go away anytime soon. These are legitimate worries that people have, but when you're immobilized by that fear and you're feeling physical signs, just like a normal panic attack, heart rate increase, chest pain, all of those things, or you're having issues cognitively, you're having a hard time thinking, or you're feeling emotional difficulties, dysregulated, you want to try the REPS protocol, see what you can do and mitigate yourself. But if you've had a history of anxiety, or you're really struggling and you've got difficulty because you need to get back to work, you need to find help, and you can do that very easily with a licensed mental health provider.
Awesome. Thank you so much, Doctor, for your time this morning and sharing your expertise. We certainly appreciate it.